Question number 1. A 6-year-old patient has been diagnosed with acute rheumatic fever. The nurse knows that antibiotic of choice of this illness is options benzathine penicillin, B. amoxicillin, C. erythromycin, and D. vancomycin. So here the correct answer is benzathine penicillin. Okay. So the benzathine penicillin, that is the preferred antibiotic for preventing and treating group A streptococcal infection, so which can lead to acute rheumatic fever. It is often administered as a single intramuscular injection. Other antibiotics such as amoxicillin or vancomycin is not typically indicated for the treatment of acute rheumatic fever. The penicillin 5 or oral erythromycin may be used if the patient is allergic to benzathine penicillin. Question number 2. A 3-year-old newborn is diagnosed with Hirschsprung disease. The nurse is conducting a physical examination. Which of the following findings will allow the nurse to suspect this disease in the newborn? Options: A. Palpable sausage-shaped mass, B. Stenosis of finger and toes, and C. Failure to pass meconium within 24 to 48 hours of life. Option D. Weight less than expected for height and age. So here the correct answer is option C. Failure to pass meconium within 24 to 48 hours of life. So Hirschsprung is a congenital condition that is characterized by the absence of ganglion cells in the distal part of the colon. Okay. That is resulting in a lack of peristalsis in that segment. So one of the early signs, okay, that is the failure to pass meconium within 24 to 48 hours after birth. Okay. So this is mainly due to the obstruction that is caused by the absence of ganglion cells in the affected portion of the colon. Question number 3. A 20-year-old client takes cyclosporin 100 mg by mouth twice per day. She had heart transplant 2 months ago and complains of dizziness, shortness of breath, lightheadedness and fatigue. Her capillary refill greater than 3 and BP, that is 90 by 50 mm of Hg, and heart rate is irregular 100 beats per minute and respiratory rate 28 beats per minute and temperature 38 degrees Celsius. What is the most likely underlying cause of the patient's problem? Options: Option A. Cyclosporin toxicity, B. Hyperkalemia, C. Organ rejection, and D. Infection. So here the correct answer is option C, organ rejection. So the symptoms of organ rejections, okay, that is including dizziness, shortness of breath, lightheadedness, fatigue, okay, that is along with the signs of increased heart rate, irregular heart rhythm and elevated temperature. Okay, so that could be the signs of organ rejection. So it is crucial to assess for signs of rejection in the transplant recipients, okay, and promptly address any issues, that is to prevent further complications for the patients. Question number 4. A 5-year-old child was seen in the emergency department with abdominal pain, palpable sausage-shaped mass and intussusception suspected. Which of the following is the best diagnostic evaluation? Options: Option A. X-ray, B. Endoscopy, C. Rectal biopsy, and D. Ultrasonography. So here the correct answer is option D, ultrasonography. So for suspected intussusception in a child, ultrasonography is the preferred diagnostic evaluation. it can effectively identify the characteristic features such as the target sign or definite sign, that is aiding in the confirmation of the diagnosis. If we are doing X-ray, that may show signs of obstructions but are less specific. Question number 5. A patient has come to the clinic for follow-up 1 week after being discharged from the hospital for treatment of a hypertensive crisis. BP stabilized at 124/78 mm of Hg. The patient report feeling well, has no edema and no longer has daily headaches. BP is 156/90 mm of Hg during evaluation. The patient admits to having stopped taking medications that had been ordered because headache are no longer present. Unless the symptoms return, the patient states they will not be returning to the clinic. What should the nurse do? Options: A. Continue care plan as written. B. Refer patient to dietitian. And C. Add a no problem to the care plan, non-complaints. And D. Refer to doctor. So here the correct answer is option C. Add a no problem to the care plan, non-complaints. Okay. So the non-complaints with medication regimen, that is a significant issue that needed to be addressed in the care plan. So the nurse should engage in patient education, explore the reasons for non-complaints and work with the patient to find solutions that ensure adherence to the prescribed treatment plan. Question number 6. A 5-week-old newborn was admitted to the pediatric ward with pyloric stenosis. The newborn has weight loss and projectile vomiting during feeding. They scheduled surgical repair of pyloric stenosis. Which of the following postoperative interventions for this? Options: Option A. Intravenous fluid. The infant is retaining adequate amount by mouth. B. Administration of proper analgesics until infant discomfort resolves. And C. Start feeding immediately after postoperative. D. Vomiting is uncommon in the first 24 to 48 hours. So here the correct answer is option A. Intravenous fluid. Infant is retaining adequate amount by mouth. So after surgical repair of pyloric stenosis, the infant may initially receive intravenous fluids. If they are unable to tolerate oral intake, if the infant can retain an adequate amount by mouth, then transitioning to oral feeding, that may be appropriate. So this helps to ensure hydration and nutrition while monitoring the infant's ability to tolerate feeds postoperatively. So here the correct answer is option A. Intravenous fluid administration if the infant is retaining adequate amount by mouth. Question number 7. A patient is on oxygen using a necessary cannula at home. The doctor has ordered this patient to receive oxygen 6 liters. The oxygen concentration is at options: Option A 20%, B 27%, C 35% and D 42%. So here the correct answer is D 42%. So approximately oxygen concentration can be calculated as, if the patient we need to administer 1 liter per minute, okay, oxygen concentration is 24%. In case 2 liter per minute, the concentration is 28%. Like that, for 3 liter per minute, 32%. For 4 liter per minute, 36%. And 5 liter per minute, the oxygen concentration is 40%. and in case 6 liter per minute, the oxygen concentration is 44%. Okay, so therefore the answer closest to the estimated concentration of 6 liter per minute is 42%.